It's now time, though, for our Great British Debate this hour. I'm asking, should nurses go on strike? Now, the Royal College of Nursing have reportedly voted in favour of strike action, with more than 300,000 members taking part in a strike ballot, which is the biggest in the 106-year history of the union. Now, the ballot results are set to be revealed next week, but according to research commissioned by the Royal College of Nurses, nurses' salaries have fallen around about 20%, that's in real terms. So if you imagine your income in real terms are falling by about a fifth, that's quite considerable. And that is in the UK since 2010. So they're basically working for the equivalent of 1 day a week for no pay at all, which is pretty much unacceptable. Now, NHS England data has also shown that in September, more than 13,000 patients a day were deemed ready to be discharged but were stuck in hospital beds. That's as nearly 400,000 patients are waiting over a year for treatment, and that's not to mention the severely long ambulance waiting times as well. I mean, it's ridiculous. We're able to house migrants, loads of them, those who've come over from the Channel, spending 7 million a day, roughly. And for the people who are in this country, we're unable to sort of find a way of giving them somewhere to be whilst they've come out of hospital. It's abhorrent. Now, if the government at one point were willing to pour money into other areas, including tax cuts for the rich and hiring diversity managers for the NHS, why not pay our key health workers more? Do you remember the 45% rate that was going to come down to 40? That would have saved about, would have lost about 1.8 billion. They could have used that to increase the nurses' wages. So in this hour, for the Great British Debate this hour, I'm asking, should nurses go on strike? I'm joined now by psychiatric nurse Julia Taylor. Julia, thank you very much for joining me. Julia, can I ask whether you voted to go on strike or not?
I haven't voted, but I'm not going on strike. Definitely not.
Why not, though? I mean, all the figures, your wages have fallen, a day literally extra in terms of how much you're paid. Why not?
Mm-hmm. Because the patients are going to be put at risk. Patients, when I say put at risk, I don't think anybody's going to leave anybody in dire straits. However, what you've got is people waiting for knee operations. People have been waiting for years for operations everywhere else. And sadly, the list's getting bigger and bigger and bigger. If I go on strike one day, that's going to affect that. And it's going to make the list of patients waiting even longer than it already is. And as a nurse, sadly, they've got us over the barrel, really, because I don't feel I can strike because I don't want to let my patients down. And then this might sound a bit extreme, and I'd probably get shot down in flames for saying this, but would it not make us no better than just stop oil with the people that they're stopping getting to hospital because they're blocking roads? We're going to be standing outside, no, we're not going to work, we're not going to help you with your operation, we aren't going to do that. Sadly, I just can't. I can't strike. I can't bring myself to do it. And some of my colleagues are, and some of my colleagues aren't intending to strike. But personally, I just can't do it. It's not in my nature. I didn't join the NHS for money. Crikey Moses, if I'd wanted money, I'd have gone to the private sector and been an agency nurse. And Nana, do you know how much they spend on agency nurses every year? They could use that money to pay nurses more wages. It's 423.5 million a year on agency nurses. They get paid an absolute fortune. Sometimes you're working on a shift with somebody who's getting about £30 an hour more than you, and you're doing the hard work. And I think, because the government haven't managed this, I actually do think they're trying to run the NHS into the ground because I think they want to privatise it. I think that's what this is all about. But I still won't strike.
You still won't strike. You just stay right there, because I'm also joined now by political commentator Sam Dowler. Sam, thank you very much for joining me. You've heard what Julia said. She's a nurse. She won't support the strike. She won't strike. But you support the strikes. Why?
You know, it breaks my heart listening to her. That she's so right. Of course, no nurse would want to strike, and you know, the risk to any patients is awful and shocking. And the fact is that there's about 47,000 vacancies for nurses in this country, and that's obviously a huge problem. So if their pay was reflected the work they do, then maybe, you know, they might be able to hire more people, but at the moment it isn't. And, you know, it was literally a year ago in the pandemic when it was protect the NHS, outside on your front door, you know, banging on a saucepan. So why on earth are the government now saying that they can't have a decent pay rise, 5% over the interest rate? I mean, I don't think there's any question for it. Nobody nobody, especially not nurses, would want to strike. But it is literally the last resort.
Well, bearing in mind that they have received a 3% pay rise, that's about £1,000 last year, despite the pay freeze, as well as NHS staff receiving a £1,400 pay rise this year as well. So they haven't gone without. But in principle, the fact that they're striking, I mean, you're saying that, but if you're the one that needs a nurse or a doctor and you're going to hospital and they're on strike, would you still support it?
Yes, absolutely. My father had cancer for a very long time, so I was in and out of hospitals for many years. And obviously, so I see the work firsthand. So as everybody does, and I don't think there are any patients that would categorically say, no, I don't think there should be a strike. And they're already saying that, of course, this won't affect A&E nurses, for example. So this is maybe, people might have to wait an extra hour, etc. But if it gets the job done and they get the pay rise that they deserve, they absolutely deserve it. My partner works in the care sector, and what they pay the care sector is absolutely shocking, even compared to what they pay nurses. And they don't feel they can strike either, because they don't want to let their patients down. It's exactly the same as your guests. So I mean, what else is there to do?
Well, let's bring Julia back on then, and you can speak to her yourself, because Julia seems to think that she doesn't want to strike because of the patients. She doesn't want them to get worse and get sicker because there's nobody to tend for them. Sam said, what else could you do if you couldn't strike? I mean, if you're not going to strike, Julia, what else is there?
Well, obviously, lobby the government, constantly write to your local MP, get on protests left, right and centre as often as possible. Big protests, though. Make our voices heard. And really, as much as I hate to say it, but I work for the NHS, the only way that this is going to be solved is to get the Tory government out. That is the way to solve it.
Well,
They've caused this.
Well, you say that, but then, this whole situation, apparently this whole economic situation we find ourselves in is more to do with a global situation, supposedly. But also the NHS is they spend the money very badly, as far as I can see. Sam, what would you say to Julia's point that if they did strike, they'd just be like Just Stop Oil?
Well, obviously, Just Stop Oil is, it's an extreme example, but I do get your guest point completely. But I mean, this is, obviously it is, there is a global crisis, but in this country, I mean, it must be galling for nurses like yourself to see, BP and Shell making the amount of profits they do and us not tax them, or, 44 billion wasted on PPE for the Tories' mates. I have to agree with your guests again and say that I think there should be a general election, because this is under the Tories government that this has fallen apart. So I mean, this is why I have to support the nurses, and I'm sure your guests as well. Even though she isn't going to strike, but she will be supporting her friends and her partners who will do.
Well, it is a shame that it's come to this, but Sam, surely though, as I put it to you before, that if it was you who was sick and needed the care and there was nobody there for you, are you sure that you would feel the same way?
I've read a lot about this and watched a lot about this. People, nurses aren't going to be turning their backs on their patients. They're not going to be doing that. It's going to be organised in a correct way. Of course, they're withdrawing work. That is what a strike is all about. But then there's obviously so many jobs and stuff that they won't do, but looking after the patients isn't going to be one of them. I don't think patients will be put at risk, and I don't think nurses would do that. That is the point of their jobs.
Well, okay, but yeah, you say that, but it's interesting you say, because basically then there's something organised, isn't there? So it's not quite on strike, is it? They are still able to tend to you, and that's the point. If they couldn't go on strike, would you support a situation where they're not allowed to strike, but they're paid, say, in line with inflation or something like that? Would you support that premise, that they're not allowed to strike? There are professions where you cannot strike.
Yeah, I would definitely, as long as we were in line with inflation. I don't like the idea of being told we can't strike, because we live in a democracy, so they say, and obviously we should be allowed to do things, not to the extreme. I think we should just work to rule and finish on time, have our dinner when we're supposed to. That would cause mayhem. Actually, it really would, because half the time we finish a bit late, we start early, we do more work than we should. And if we just stop all of that, it would be a disaster in a day if everybody did it.
Well, listen, thank you both for your thoughts. Really good to speak to both of you. What you said is definitely food for thought. Julia Taylor, thank you so much. And also Sam Dowler, who's a political commentator.